Okay, she's dealing with sacral pain, always. So the way I'm going to figure out where to focus is, because usually sacral pain in reflexology is in this area, that's the sacrum, and so it's definitely tight right there in her thumb. And so I know that this is connected. So what I'm gonna do is, so I can hit all variables that add to the tension, I'm gonna get this released real quick. Not too long, because we want to get lower extremities prioritized over upper. Because she does complain about pain in her neck as well, but never had an accident. It's already released there. So I'm hitting the nerve ending and turning that off so that it can relax all the way up her arm, and her wrist is already going where it should. It's already a lot softer in here. Okay, so now that I got that released in her hand, so we're gonna, this is just a little quick version. We're gonna go to her shoulder. Okay, oh, sorry. I got your face a little bit, sorry. Okay, so since the thumb is pulling on this fascial line all the way up to the shoulder here, that's going to lead to tension right at the top here. And so that's probably what's pulling on her neck. So since I got the thumb released, it should release in her shoulder pretty easy. So I just kind of let it know you no longer have to fight, and it popped. All right, so that's nice and soft right there. Okay, I'm gonna get her other side real quick. So I think this side is what's worse. Typically the right side, because you're right side dominant. I'm checking her pinky. It's not too bad actually. That's probably why she's feeling it in her midline more. So the thumb itself, right along the midline here. We're gonna check it in the wrist. It's definitely twangy right here on the outside. Her other hand, it was slightly more medial there, but her right hand, it's right on that midline. That would resemble the spine. So I need to get on the thumb, less on the flexors, a little bit more on the extensor side, but not quite. Still very midline on the thumb. That's where I'm feeling it. Take a deep breath. All right. Got the wrist back where it needs to be. Alright, so that means it's not going to be so much bicep, it's going to be right on the top area here. So other shoulder is going straight up. This one, I'm going to go this direction a little bit more. Slightly out of frame, but that's okay. And that one popped a little too. So now that everything is nice and relaxed, it'll go where it should, and we release the tension that is leading straight to her neck. That's only secondary. So now we're gonna go to the feet, because this is like working on the hands. This is why I love working on feet and hands so much. So here's her feet. Now you can already see. Can you guys see that? It's very obvious to me. So when you look at her toes, this one is down from that one. But do you see on this foot, this toe is down from that one? So that's telling me this foot is going to be this toe. That's the culprit. That's pulling all that tension, which is accurate because that's what we found on the thumb, because it's not exactly midline. It's a little bit further in. So that would make sense. It would be more that toe. So this one, it was more midline. So it's gonna be this area, which is, there's a callus right there. So that's the indicator of where she's pushing off really hard. And also right here, that indicates where the point of pressure is, where she pushes off. So it's not as bad here, a little bit there, but really it's both of her big toes. So we gotta get those nice and relaxed. If her sacrum, because in reflexology, your sacrum is right here. So anything causing tension on this bony protrusion here is going to be coming from here, which is why we make sure this is nice and happy. So with this one, all that we do is we palpate, and it's slightly curved this direction. So I want to push right above the joint, and I do pressure into the toe. You probably can't see that. Pressure into the toe and down towards the joint. So all of my intention is pushing everything back to the core. But if I can get the nerve to disengage and relax, then I can get everything to let go and quit pulling and challenging that sacral area. That one needs to get released. And I can feel it melt. And release here. Hopefully this video isn't too long. I know the way that I video can look boring, but there's a lot happening here. Okay, so now that the toe is released, I can get movement in the joints. I don't ever stretch down this way, because when her foot is relaxed, her toes aren't pointing like that. So I only want to stretch this way and this way, because that's where it's showing that it's short. That one hasn't released yet. Oh, there we go. And this can actually help a lot with preventing bunions or because when it gets really, really tight right in here, it pulls this way. So if I release tension that way, this will get nice and relaxed there. And then right in the middle of the foot, it's nice and relaxed. So there's tension here. Well, the tension here is released, but I do feel a level of scar tissue adhesions. So she probably ripped that a little bit at some point. So it's not the most relaxing treatment, but the only way to get that out is with friction, and the most efficient way is with a tool. So a little bit of scraping right there, which is probably a big reason why she's continually dealing with that sacral tension and pain, because if this is what is preventing that release of tension all the way up to her sacrum, then unless she gets it scraped out like this, it'll never be happy. Alright, feels not perfect. A little bit more right here. Take a deep breath. Okay. The ankle seems pretty good like that. Everything seems to be happy there. And we're gonna get this side real quick. Apparently this side is the side that's worse. I do feel the tension all the way up the ankle area here. So as far as the sacrum goes, I don't know what you can see. So the sacrum protrusion, bony protrusion, is about here. I don't feel any of the soft tissue adhesions in that area, but it does seem tight all the way at the top here. So I think the best thing that's going to help her is just releasing the toe right here. And this side, remember, it's a little bit more on the outside. And usually I can find the spot by the joint, right at the top of the joint there. But this one, I'm actually finding a little bit higher than the joint. It's just that tight. So I'm using both thumbs to push it down towards the heel. Alright, the big toe is nice and relaxed now. And I definitely got the joint to move. The very end. And then this one seems pretty angry right here. So my guess, there's some sort of soft tissue adhesions right in here. It seems like this spot right here probably ripped at some point. where like, not like a complete rip, but like something more than what you would do just lifting weights. So if you ever wake up with like your arches stiff in the mornings and you feel a burn, it's kind of like that. But this one, yeah, it's popping pretty good. Like it's got some level of trauma in there. I don't know if you can see that. But those adhesions in there can lead to the dysfunction in the base of the joint. Okay, not perfect, but so much better. That already looks smaller right there too. Alright, so we got toes nice and happy. Alright, almost done, promise. I'm gonna have her flip over. Oh, good job. Okay, so this last bit, so we're back to where the symptom is showing up. Alright, so we got the foot released, which means tension that we're in the fascial adhesions, or the fascial line. So on her right foot, if you guys remember, it was more right on the medial line. So it's going to be more on the inside area, even into her adductors. So that's where it's going to feel tight and overpower. And then the outside of the hip, right in the sacral area, that's where it's going to tighten up and try to fight how tight this is. So instead of digging into the low back, I'm going to start releasing on the leg, just some fascial work, starting at the top. And then I put my knee under here to get more of a bend in the ankle so I can get movement in the ankle and stretch while I work on that midline. And I actually don't have to do too much to it because I've already released it from the toe. So it's just a matter of really palpating and making sure there's no soft tissue adhesions to work out, or fascial adhesions where you would use a cup. So this one's actually pretty relaxed. And then a nice stretch. We're gonna get the toe involved. So you stretch the big toe first, and then you push the foot down, and then you bend at the knee. So that'll stretch that whole fascial line up to her sacrum. Okay, so I'm gonna hit the other side real quick. So this one, it was more on the posterior side of the body, and you can kind of see it in the ankle too. It's shorter right in here on this side. So it's not bad there. Yeah, there's no adhesions in the hamstring area, so that's good. But I do feel it right along here, almost like there's been a strain right in the calf there. So, get my tool. So it feels like, so if I trace it, I can even trace it from a foot and find it. Right in here. Deep breath. Okay. Yep, I got that pretty good. Definitely feels softer. Alright, so that's one of the key spots that are adding to her low back pain. Get the toe, and then the foot, and then the knee. Okay, so the last bit. So I'm feeling both sides of the sacrum, making sure that there's no knots still in a spasm because it should be completely relaxed. And any therapeutic work left in this area should be more like physical therapy. So when there's a lot of sacral tension, it's coming from the legs pulling it down. So if the glutes get nice and strong and toned, it'll kind of assist in holding the legs up instead of letting them pull down, and then the sacrum will be nice and happy. But she does have a knot. Feels like it's more on her left side though. Oh, I feel it on both. But there's one right here, and literally you have to go this direction. So I'm going from hip to opposite shoulder. So the knot that you push on, I'm pushing it into the bone. I'm not trying to create any more length because it's so weak in there. It's just trying to fight. So I'm not challenging it. I'm pushing it towards the bone. And then it melts. And then to take it a step further, because I can feel right in the SI joint area, there's a knot there. So if you want to take it a step further to get them to activate this area, you just have them lift their whole leg off the table with their knee. So go ahead and then relax. And that'll get the knot to also melt pretty fast. All right, so all that work just for the sacrum, having pain in that area. I do feel that tension in there. It's like a thickness almost, but it does feel pretty soft. So that's probably all that time it's been working really hard to hold things together. So at this point, it doesn't feel like it's gonna move, because I think it's where it should be. So hopefully we got all the tension released off of it. There might be some stuff in this area too that can help, but I think we got what we need to. So if you guys want to look at it, her PSIS looks pretty equal right there to me right now. But that's all that we are working on today, because she does have a little bit of imbalance right in her lumbar spine. But everything we did today was just for the sacrum. So, the end.